I was 438 pounds. My blood sugar was way out of control, needing just a phenomenal amount of medicine at that time.
So I first met Chris in the hospital. She was hospitalized for an infection.
An infection that was complicated by her diabetes and her obesity. She was on quite a few medications, including insulin.
It was not just physically overwhelming, but, mentally as well.
In hospital follow-up, she established care with me, and then through medical home, she was able to meet Renee and Carrie to help her in her weight loss.
In the very beginning, I kind of wanted to fight it, and wasn't, I felt like someone was trying to invade in my closet that I wasn't willing to share with anybody, that I've been holding back.
Getting medications just available to her were a lot of the issues we had at first.
Renee wanted to put an insulin pump on me, and we didn't have insurance. And I was struggling with being able to afford my care here and my insulin. I told Renee and I told Dr. Moore that I would no longer take any medicine. And they said, Chris, you will dig a hole. You will die.
It really was a wake-up call for her that she needed to change her lifestyle. And I think building that relationship with our care team really gave her the support she needed to keep going forward.
Renee, the one thing she said to me that I'll never ever forget is she said, Chris, you're worth it. And at that point, it just made a whole different change. She's been a great, great support system, and I probably wouldn't be here without her.
So Renee has been a wonderful addition to our office. She is our care coordinator. She really is an educator. She's a supporter for our patients.
Communication has been key to patient-centered medical home and establishing a relationship. It's really helping them discover, each patient, what is that motivating factor for them. And I said, Chris, what would you like to do? And I think this was last spring. And she said, I would like to ride a roller coaster with my son. I've never been able to do that. And so I said, okay, that's your goal.
I guess I was just so eager to try and make the change and feel better that I tried doing all of their suggestions and nutrition and stuff.
She called me when she had reached that short-term goal, and we were able to get Adventureland tickets for her to go and enjoy their roller coaster ride with her son.
We got on a roller coaster and we rode roller coasters all day long, and it was one of the best things. I mean, literally almost made me cry that I could actually do those things with him.
So it really was this journey for her that has resulted in a lot of life changes for the better for her.
I ran the Nippy Hippie in November. I've lost 256 pounds so far in 22 months. If I would have said I had to lose, 200, 300 pounds, it would have been so overwhelming that I would have never been able to swallow that. So I took 10, maybe 20, at a time, and just kept working.
She's a new person, not only physically, but I think more importantly, emotionally.
I think you have to own it enough to want it enough, and if you can own it, come full circle with it, you can conquer anything.